Welcome to the abrupt training for confirming eligibility and randomization. Abrupt is a randomized controlled trial to investigate the clinical and cost-effectiveness of amiodarone versus beta blockade for patients in ICU with new onset atrial fibrillation or a new episode of atrial fibrillation. The latest protocol is version 4 dated the 20th of January 2025. The chief investigator is Dr. Dhruv Parekh, and the deputy chief investigator is Ingeborg Welters. The senior trial manager is Lisa Holden, the senior data manager is Kate Brailsford, the sponsor is the University of Birmingham and the funder is the HTA. Let's briefly look at the study design. Abrupt has two interventions, amiodarone and beta blockers. The route, dose and duration is entirely at the treating clinician's discretion, and in the case of beta blockers, the choice of beta blocker is also at the treating clinician's discretion and that which aligns with local practice for treating AF. The primary outcome is 90-day mortality. There are a number of secondary outcomes, safety outcomes and health economics outcomes. The inclusion criteria is, patients aged over or equal to 16 years old, patients monitored in an area of higher care with the ability to deliver the interventions, patients with new onset atrial fibrillation or a new episode of atrial fibrillation, during their acute illness either in A&E, deterioration on ward, or after surgery, where there is a clinical indication to treat with amiodarone or beta blockers, and where usual electrolyte management with potassium and magnesium has taken place according to site practice. The exclusion criteria is treatment with anticoagulants or antiarrhythmics for the treatment of AF before the current hospital admission. Please note that anticoagulants or antiarrhythmics used for any other purpose can be included. Current concomitant medication that are contraindicated with the intervention, comparator medications, for example cyclosporin, itaconazole, letermovir, a serum potassium of less than 4 millimoles, measured either on point-of-care testing or laboratory. Patients having undergone cardiac surgery during the current hospital admission, defined as any surgery including lung resections, stent procedures such as percutaneous coronary interventions or other angioplasty procedures done on the heart muscle, valves or thoracic arteries including the thoracic part of the aorta. Patients with thyrotoxicosis. Withdrawal of life support therapy within 24 hours. Any other known contraindication or known sensitivity to beta blockers or amiodarone. And known pregnancy or patients currently known to be breastfeeding. Now let's look at recruitment. Patients with AF will initially be identified by their existing clinical care team. Eligibility for the trial must be confirmed by a medically qualified doctor or an ACCP or equivalent. A screening log should be kept of all eligible patients or legal representatives that are approached about the trial. Screening data is captured electronically on REDCap Annex. Randomization is by way of a secure online randomization system called REDCap. It is available 24 hours a day, 7 days a week. REDCap is easy to use, but there is further guidance in the randomization working instructions in your ISF. Randomization may begin once patient eligibility has been confirmed. Once you create a new record, a trial number will be generated. If data items are missing, the randomization can be suspended and can be restarted once all information is available. Once all details have been completed, mark the randomization form as complete and select Save and Stay from the drop-down menu for the randomized allocation. If you are unable to randomize for any reason, please contact the Abrupt Trial Office immediately. Once the training has been completed, you will be sent an email with your training certificate and a link to the REDCap database to randomize a patient. You will be asked to create a new record and to confirm your site name and whether or not you are listed on the delegation log. If you answer yes, you will be asked to log into the database using your unique user ID. If you answer no, you will be taken to the randomization form. Screenshots of the database follow on the next slide. So to recap, confirm that you want to create a new record and then confirm your site name and whether or not you are on the delegation log. Confirm that you have completed the training and then provide your name as the person confirming eligibility and randomizing the patient. You will then be taken to the randomization form. Please complete the form noting that we are using deferred consent in Abrupt, so consent does not need to be in place before randomizing the patient. Mark the form as complete and select Save and Stay from the drop-down menu. The randomized allocation will then be shown. Mark the form as complete and select Save and Exit Form. Thank you for completing the Abrupt training for confirming eligibility and randomizing patients.